When Hospital Rooms got in touch with me about the Northside project, I was really excited. Both my parents, they immigrated to the UK in the 70s to work as nurses for the NHS, and they both worked on mental health units for over 30 years. So this opportunity had a very personal resonance for me. I'm going to share some slides. Sorry about that. Okay. So I've taken a lot of inspiration from how other artists have responded to other Hospital Rooms project, and it's been wonderful to see how varied and diverse each response has been. And I think Hospital Rooms have created a really interesting way to think about the relationship between art and physical and mental health. And as an artist, I think this is inherent to most art practices, even if not immediately obvious. So I saw the Northside project as an opportunity to more closely combine the two. So I'd like to talk about my proposal for Northside, as well as the workshop I led last year, but I wanted to start by giving a very brief introduction to my work so you can get an idea of how I came up with ideas for both. So I'm a painter, and my work is about how landscapes and interiors can become sites to reflect upon memory and identity. The paintings I make are based on my childhood visits to my parents' home countries of Malaysia and Mauritius, and the feelings of longing to revisit them, but through my imagination. And so colour plays a really important part in my work, and last year in an exhibition, I wanted to take this further outside of my paintings into the gallery itself. And I've been thinking a lot about how colour is a deeply personal language and how it can be used in a very simple way to transform a whole space. And I tend to use colours which are bright or even intense as a way to think about how we can also travel through colour. I also paint a lot of windows in my work, and within this particular gallery space you can see here, there was a window opening onto a courtyard which looked like an image that I would paint. So I used this green wall I painted as a way to create another painting of this frame view within the overall space. So going into Northside, I knew that using colour and referencing windows somehow would be an important element for developing my proposal for the project. So I was fortunate to visit Northside in December last year, and I'm really glad I got the chance to explore some of my initial thoughts. And for the workshop, my first idea was to do a painting or drawing workshop, but what I really wanted to explore was colour and landscape in a more abstracted way. And I think with painting or drawing, there's a tendency to try and recreate exactly what's in front of you, but that's not what I really wanted to look at. So I went with a collage workshop, and I worked with the Hospital Rooms team, the patients, and the staff to make these memory landscapes using coloured cards and some shapes that I previously cut out before the workshop. So I incorporated some of the shapes and elements that I use in my own paintings to see which particular shapes and colours people were drawn to, and so I could somehow use these in my proposal. And it was really important for me to get to know the people in the unit and get a sense of how they felt about the work, and the staff too, as they obviously spend a lot of time there. And so both of these were important factors that really shaped my ideas. Before the workshop, we were kindly given a short tour of Northside, which was really insightful, especially looking closely at the spaces in which they wanted artists to respond to. And it felt like, although much of the architecture had been carefully considered, the ways in which some of the rooms were decorated seemed somewhat counterintuitive. And so as an artist who is used to making work to be displayed in a gallery, I found the shift in brief quite substantial. And I wanted to make sure that whatever I ended up creating would be held up to a different type of scrutiny. So I think I knew quite early on that simply hanging paintings within a space wouldn't have a significant enough impact, and that the most useful thing I could do would be to transform the space as a whole. And so I was shown a recreation room which had a window overlooking the hospital grounds. And I knew this could be a space where I could create something uplifting for the occupants, but also try and bring a sense of warmth and softness to the room that felt more like a domestic space. And I felt, I found putting the needs of the occupants first. It felt almost like a design brief rather than sort of my typical working methods as an artist, but it was also really refreshing. I liked thinking about creating an artwork with the same level of care and attention as I would for an exhibition. And so I tried to put myself in the position of someone living there day to day and thinking a lot about how tethered to the space they were. And so I've created an idea for a mural to span the whole of the space, which will depict a tropical landscape in a mixture of bright and subdued yellow colours. And I've also played with the window and included an arch to reference some of the shapes that were used in the workshop. I wanted to have a feeling of vibrancy and joyfulness in the composition, something that might stimulate the imagination, but also take people beyond their physical reality. And I was also very drawn to the window again, and I wanted to acknowledge the view in a way that didn't retract from the window, but accentuated it. I have some experience in creating large wall paintings, and I enjoy how the scale of them relates to the whole body as opposed to just sort of your eye level view. And I want the painting to feel immersive, but also like a haven, as I know that the room is a quiet space, so I think it's important to retain that sense of peacefulness. So I hope that the end results will emphasize some of the room's pre-existing qualities. Yeah, luckily it looks like the project's back up and running soon, so I'm really looking forward to going back to Northside and to get started on the mural. And I also just wanted to say a quick thank you to everyone who has been working on this project and to the university for putting this talk together. It's been a really amazing thing to be part of, so thank you.